A breathing technique for coronavirus patients is said to help people with COVID-19 symptoms is from a British doctor identified by the Times as Dr. Sarfaraz Munshi from Queen's Hospital in London. He urges patients to begin practicing the technique right at the start of their coronavirus infection or even before any symptoms began. The technique. Take a deep breath in. At the end of it, hold your breath for 5 seconds, then release. Do this 5 times, 5 breaths total. Next, take a 6th deep breath in, then at the end of it cough strongly, covering your mouth when you do so. The 6 breaths plus cough at the end represent one cycle. Repeat this cycle twice. Munshi then instructed patients to lie on their stomach on a bed, taking slightly deeper breaths than normal for the next 10 minutes. The majority of your lung is on your back, not on your front. So by lying on your back, you're closing off more of the smaller airways, and this is not good during the period of infection. He credited the exercise to Sue Elliott, Director of Nursing at the Partnership of East London Cooperatives. It's not specific to COVID-19. Any condition that leads to a lot of mucus can be benefited from this. In doing this breathing technique for coronavirus patients, the idea is to get the lower part of a person's lungs to expand so that any mucus that's collecting there can be dislodged and then coughed out. The initial deep breathing helps all the airways to open up, then the cough at the end of the 6th breath helps loosen the mucus that's been affected by those deep breaths. Patients with the severe type of COVID-19 are often described as drowning in their secretions, so anything that can get the mucus moving so it can be coughed out would be beneficial, he added. Lying down afterwards is part of what doctors call postural drainage, or putting a person's lungs in a position so that gravity can pull any loose secretions out of the organs. This breathing technique for coronavirus patients is recommended for people who already have coronavirus symptoms such as a cough and shortness of breath. A person who is infected probably needs to repeat it several times a day. It is advised to try it while seated since such breathing can lead to dizziness for some, as it did for Munshi, the doctor in the video. Doing the technique wouldn't prevent someone from getting COVID-19. But deep breathing can also be helpful for mind and body and meditation and relaxation. Just the act of concentrating on your breathing may release some stress, make people feel good. Thanks for watching today's video. Did you learn anything new? Don't forget to subscribe for more daily videos.